Okay, well, I had to bring back my friend Rachelle to talk about another connecting skill called speaking authentically. And for me, speaking authentically is tricky to do it well, in the sense that that means speaking authentically means speaking our truth in an open and vulnerable and kind way. And I know for me, as one of my protective patterns, or the way I sort of cope with things, is in an attacking way. And sometimes we use the notion of speaking authentically to just lay waste, right? I'm speaking my
Yeah.
truth with fire at you. And so I'm hoping you might talk about, in your patient care experience, the fire that came through the door, if you would be so kind.
Sure. I would have patients sometimes that were so afraid, worked up, angry, had a horrible day, had other things going on, or just did not want to be there. They would come in and they would be cussing at me.
Yeah.
I would have patients that would just let fly. And the first reaction is to, step back, and I would have to take a beat and say, okay, this person's obviously really frightened, or they have something else going on. So take that moment, ask them, talk to them directly, and ask them if there's anything you can do to make them feel better, if they're going through anything, and having them communicate with you. And a lot of times those people, the ones that were the most worked up coming in, were hugging me on the way out the door and telling me how great the experience was. So
Right.
it was very rewarding in that respect.
Right. Coming in hot also
Yeah.
sort of has that intensity, right? So that's
Yeah, very
two
true.
dimensions of that, in the sense that that's my work, is to soften that. And I appreciate that through your sort of empathetic and inquiry lens, which you were then able to connect, that their version of speaking authentically, sort of, you allow that to happen. And I guess too, with your time in the field, how do you appreciate when people are at least speaking authentically, though maybe not politely? What is there anything for you that you appreciate as you're trying to build relationships?
Well, as awful as it may be sometimes with the cussing and the speaking being very heated, you kind of just cut right to the chase. There's not a lot of dancing around the subject to get to the heart of it.
Oh, great. Right. Yeah. So it's a shortcut to
Yes.
what someone's really feeling. And that's my admonition is, I know how I feel, and then I tell everyone, but that
Yeah.
doesn't always serve me. Right. So I even think in the patient experience, if we're coaching people to speak authentically, even if you're going into a clinic setting and you're not happy about, someone coming in trying to do treatment to you, being open to it and then speaking authentically in a kind, vulnerable way, despite our fears, will also sort of expedite the care experience, so
Absolutely.
yeah.
However you get there.
However you get there, right? That's the goal, is the connection between patient and care provider is essential for whatever the journey you guys are taking together. So from a centered place and building connections, thank you for your time, and super appreciate it, as always.
You're welcome.
All right.